Okay, hello and welcome back to the Digital Health and Wearables series. Today I have another magnificent guest and leader for you. But before I go ahead, make sure you subscribe to the channel and also check out all the great content previously with lots of leaders and share this content with your communities in healthcare. And today we are here to talk about health coaching, but also I'd like to acknowledge our digital health platform CliniTouch V and our series partner Fujifilm Healthcare. And now let me introduce you to our guest today is Eugene Borukhovich. He's a leader in healthcare. He's also the COO and co-founder at Your Coach. Eugene, how are you?
Fantastic, and thank you for having me on. You've had some amazing guests, so I'm honored to be here. And we can actually go broader than health coaching. I know you and I have been kind of in the trenches of digital health. I think it was probably before it was called digital health. So
Yeah, Eugene, it's fantastic. Before the recording, we're talking about where we met in Germany, in Leipzig, but also in Barcelona in the Health Week conference back in 2015, 2016. And we've been actually doing things for a long time. I do agree with you. Before it was probably called digital health. So nice to have you here.
absolutely, thank you.
Brilliant. I'm going to go straight to the question. Is that okay with you?
Yeah, let's dive in.
So today we are focusing on health coaching. So to start with, what is health coaching?
Yeah. Well, I'll give you a very kind of short definition. I actually took a 9-week course, which is like an expedited course as a CEO of a health coaching company. I should know at least what it does. And the way I kind of describe it as a non-clinical psychotherapy, but ultimately a health coach is someone who is there to help you understand, set, and achieve the goals, right? This is typically a non-clinical person. However, what we say is a health coach is not necessarily a dietitian, it's not necessarily a doctor, it's not necessarily a fitness instructor, but all of the above can go and get their health coaching certification. Now, we as a business are focused on US. There's health coaching associations around the world. And lastly, what I'll give a little bit of the background. The profession has been around for probably over 2 decades now. And only in the last, what I would say, since 2013, 14, when the National Board of Health and Wellness Coaching came onto the scene in the United States of America, there's been some frame that was put into place on how do you certify a health coach? What does it mean to be a health coach? What are the jobs to be done by a health coach? I'll pause here because I wanted to give our listeners and viewers a little bit of the history, a background, and a short definition.
Oh, that's fantastic. Is anything that you want to say around health coaching?
Yeah, so I think today we're hearing and seeing health coaching everywhere, right? I think every company is talking about health coaching, whether you are a online prescription like Lemonade that prior to the acquisition and launch health coaching service. We're hearing health coaching as a buzzword, and I think ultimately what we need to do and educate the market is many companies are looking at health coaching as what we kind of put it in quotes nudgers, non-clinical labor force that can help consumers and patients stick to some kind of a regime, right? And behavioral change. Now, there's much more to health coaching that's just nudging. Actually, nudging is not even a part of it. There is a science behind it. There's motivational interviewing techniques. There is reflection that coaches try to get you as a customer, as a consumer, as a patient to reflect on certain things, and many others. So I think there's a beginning, while the health coaching as a buzzword is now here, led by many companies out there. The reality is there's still much more education to do, and there's much more clinical evidence that we want to bring to the table as well as an industry. Lastly, on that clinical evidence, we did a report, health coaching report, when we sort of came into the scene in January, February of 2020 as a company. And so much has changed in the last 2 years, but at the time we did a scan of clinical trials, and even back then, 2 years ago, there were already ongoing clinical trials of 200 plus. I think 100 plus finished, 100 plus were ongoing. to show the benefits of health coaching surrounding a product, a service, a molecule, etc. So we're just in the beginning of this health and well-being coaching as an industry. And I'll have a lot more to say as we continue talking around how it interfaces with the digital health company, digital therapeutics, and other things.
Oh, fantastic. Oh, thank you so much. I do agree with you. The educational side is very important. Also, we talk about in healthcare the change of behavioral piece. Health coaching can really cover and close these gaps. Thank you so much for that amazing overview. And personally, I've been in healthcare for 20 years and I was in corporate wellness. So I know a little bit about health and well-being, and I've done many qualifications. Probably I could cover as a health coach as well. I never, yeah.
I actually just want to add one thing. You brought up the corporate wellness market, and we do have an offering for SMBs in that space as well. But the reason I wanted to bring this up, as you mentioned it, I think for the first time we're seeing this roughly 4 trillion, wellness economy, and at least in US 4 trillion, but globally 8 trillion healthcare economy. And probably somewhat selfishly, but we're trying to look at this as health coaches is starting to become the glue between well-being and wellness and healthcare, right? And we're seeing health coaches in a preventative fashion into managing a disease, into reversing disease, right? And the whole spectrum of leveraging this, I'll say, relatively new workforce to help us beyond the tools and digital tools that we have today, because not everybody is going to adhere to a cognitive behavioral therapy, even if it's digitized, right? So there needs to be a person that you can lean on, hence our logo, by the way, the Hito.
Eugene, I love that. With the previous guest, I'm going to move to the second question, which fits very nicely with this. But with the previous guest, we actually talking about the paradigm between the wellness and healthcare. And what you share is very powerful. That health coach can be like the glue to merge the two together. So I really, really like that. Thank you so much. Moving on to the second question: why is this important to healthcare and digital health?
Yeah. So, we've seen, if we follow I'll stick with digital health first, even though my comment is, I think today, if we look at all the funding rounds, virtual care, at the end of the day, this is health reinvented, right? In the last literally few years, and going back as far as you and I do. So I think we've been trying to, as an industry, optimize every piece of the process, which is happening everywhere from hospital systems to insurers to pharmaceutical companies, and optimization of processes via technologies, but also obviously human beings involved in redesigning those processes. But I think we came almost so reliant that technology can fix everything, without realizing that there's a human being on the other side, and not just a patient, but also a consumer that might be a worried well, might be something that to do with early onset of anxiety, right? Even preclinical anxiety. And how do you navigate, right? Your own health, your own health care. And I'm not saying health coaches are there as navigators, right? I actually, it's completely the opposite, but it's somebody who can help you understand your goals. And that's what I think we've been missing in a health and care system, right? Both, digital health, reliance on tools, instead of thinking that, we kind of have a saying here that, today, for the foreseeable future, never say never, I think the technology is coming, but humanize better than AI when it comes to human relations, right? Now, we've seen some data from Wobot and many others that people are able to actually form relationships with chatbots, right? But we do believe that when you hit something, you hit a challenge, you typically call a friend or somebody you can lean on, right? So this is why we believe that's one key component. The second one I'll be much shorter on. Even today, doctors and nurses inside the healthcare system, especially given what we as a society going through in the last 2 years plus now, everybody's bombarded. There's even less time for doctors to see their patients. There's less time for nurses. They spend time administrative. And I'm not saying that coaches are plentiful of time, but it's another profession that is educated, that can help the healthcare system to alleviate follow-ons, to help those patients upon discharge, those patients that are going through clinical trial, those self-paced, uh, digital therapeutic, a self-prescribed digital therapeutic, non-prescription one. Those human beings that are going on it have a health coach that can help you achieve, understand, achieve, and get to the bottom of your goal. So those are the two key things.
Fantastic. Thank you so much. I always, when I think about health coaching, I always think about, I have an interest in wearables, right? And I always think about when Google, before Google acquired Fitbit acquired a health coaching company, because health
Twine,
coaching
yes.
is really important and is the missing link with wearables, because the wearable on its own is really good, blah
Yep.
blah, but they're not the miracle. People expect, oh, I have a wearable, now I become really healthy. So the health coaching is extremely important to go together, as you mentioned, with technology and everything else. So fantastic.
It's interesting, and I know our time is somewhat limited here, but I just wanted to make a comment that we do believe in data-driven health coaching, right? And we're doing quite a lot for our community of coaches. We've gathered over 2,100 coaches at this point on the platform, and educating, because there's a lot of work that schools like Dr. Sears and Duke and many others have gone to educate coaches on the science of health coaching. We're also trying to educate health coaches on, let's call it, the science of technology and digital therapies and wearables and tools, because data, while I always joke around, data doesn't speak, human beings do, right? And I do think it's super important, because understanding your client, and whether that's a consumer client or patient, your client data is super important, right? Coaches cannot prescribe, coaches is a non-clinical, but understanding where you are in your journey is super important. So we're doing quite a lot of education in our toolbox. We already have some companies like Happify, for example, in our toolbox for mental health, self-paced non-prescription. So just as an example.
Brilliant, Eugene. Thank you so much for that. And the third and final question is, where is it all going?
Yeah. Well, if we had a crystal ball, but given we are a health coaching company, so we're a couple of things. I think we're seeing a couple of trends. One, many nurses are actually leaving. We've been hearing about this great resignation, right? And especially in the healthcare system. Many nurses are leaving the healthcare system, unfortunately for the patients, but fortunately are becoming health coaches as well. So they're going for the national board. So we do see a huge expansion in the supply side of health coaching as an industry. That's one. We do foresee that more clinical evidence on the value of health coaching through the journey of an individual, a human being, from prevention to chronic disease management. That's two. So more clinical evidence. And then three, we do believe that there will be reimbursements coming. So just to give you a quick note that, as I mentioned, I think earlier in the podcast, in 2019, the AMA and the National Board of Health and Wellness Coaching released CPT codes for testing. These are level 3 CPT codes. We do foresee we'll get some more progress this year and going into next year, that there will be reimbursements for health and wellness coaching. So those, I think, are the three things that we're seeing. And ultimately, the reason for all of this is, how do we help human beings like ourselves be healthy and happy? It's very tough, especially these days.
Very important work. Well, congratulations on the magnificent work and all the things that you've been doing. And we talked about before the recording about our involvement in digital health, and we've been doing this thing for a number of years. Eugene, thank you so much for your time, for your expertise and everything. And before I round up, I have one last thing for you. It's not really a question as such, but I finish all my episodes with 1 minute of fame. You can mention anything, personal achievements, family, you can mention your coach, your company. I mean, you can mention anything whatsoever. So to round up, over to you, 1 minute of fame.
Yeah, what I would like, I'm going to start this off with balance, and that's what I want to focus in this 1 minute or less. I think prior to what we've hit in January or March, depending on the country you're in, I looked at 2019 and I spent something like 246 days on the road, right? And I think while things hit us hard, right, human beings are really made for change, right? And realizing that we can persevere as a society. And what I've learned in the last 2 years is that balance is important. I've got to spend amazing time with my family, right, in the last 2 years. And I think going forward, balance is really going to be a key word in my vocabulary.
Wow, that's a fantastic, fantastic way to finish. Eugene, thank you so much for being in here, accepting my invite, but also to share this amazing, valuable content with our viewers and listeners. Thank you.
Pleasure. Thank you.
I'm going to round up now. Many thanks to our viewers and subscribers. Make sure you subscribe to the channel. Also, I'm going to post the links with to connect with Eugene, connect with him on LinkedIn, on Twitter. Check his amazing company, Your Coach, and also check our digital health platform, Clinitouch V, and our series partner, Fujifilm. And I'll see you all next time.